Plantar fasciitis is tension and inflammation in the plantar fascia. In the arch of your foot, we have the connective tissue that runs underneath the foot and fills in the area of this arch. In that area, as the arch collapses, or if we have tension in the calf muscle, what will happen is it starts to pull and tug on that fascia. That pulling and tugging creates inflammation, which causes the pain. Typically with plantar fasciitis, we have pain when we first stand on the foot after being off of it for an extended period of time. So like when you first get up in the morning, excruciating pain. If you sit down and rest, as soon as you get up, you have pain in that arch of the foot. This can be quite debilitating. In terms of treating this at home, good arch supports, sometimes those do need to be custom made by a podiatrist. Good fitting shoes are very helpful, and remember, shoes do need to be replaced fairly frequently in order to retain the proper foot support. For exercises at home, I recommend two things. I recommend somebody get a tennis ball or a golf ball and put that on the bottom of the foot, and then use that, and then stand or sit and push on the golf ball or tennis ball and use a massaging motion to move those tissues in the foot, to stretch them. And so you have the ball, you step on it and move the foot back and forth and rub out the tender spots in the fascia and stretch it. You can do that a couple of times a day. Another thing that you can do is you can take a water bottle, don't fill it all the way with water, but most of the way, and put it in the freezer. Put the lid on it, put it in the freezer, let it freeze, and then use that water ball, just like the golf ball, to roll over the foot and to stretch the tissues. This can also be very helpful, helping to relieve the pain and also stretch the tissues to treat plantar fasciitis. So treatment of plantar fascia pain from a traditional medical perspective involves rest, involves good arch supports, well-fitting shoes, and then also some basic exercises, as well as steroid injections into the plantar fascia. So while steroids can be very, very helpful, there's also some side effects that, although not necessarily the most common, when they do happen, they can be rather serious. Additionally, osteopathic manipulation can be helpful, because as we change the way that we distribute weight in the whole lower extremity, because remember, we can't just isolate body parts. The foot's connected to the knee, it's connected to the hip, it's connected to the low back, all the way up your body to your head. And so if you're not distributing that weight properly from your head all the way down to your feet, that can also predispose you to developing plantar fasciitis. Acupuncture can be another great adjunct. Acupuncture works by treating the tissues, it treats the fascia, it treats the pain generators in the muscle. It also activates your body's natural painkillers and also helps the body to clear out the inflammation that's causing the pain. And then finally, we have the regenerative injections. Prolotherapy and PRP can be outstanding treatments for plantar fasciitis. Oftentimes, the prolotherapy or platelet-rich plasma can be really a key to helping to stop the recurrence of plantar fasciitis. And so I really encourage you to look at those treatments. And so in summary, for most foot pain, we want to make sure that we don't have a fracture or another serious problem like that in the foot. Oftentimes, these disorders in the foot are caused from a breakdown in the biomechanics of the foot, meaning that we're not distributing weight properly. And because we're not distributing weight properly, the muscles and tendons and ligaments aren't wearing as they should. And so as they're undergoing this extra tension and strain, they start to become inflamed and they start to hurt. And this leads to the pain of plantar fasciitis, pain on the top of the foot, etc.